think that patients are aware enough of how much they could be going off of, not necessarily, I don't want to call it like the deep end, but how much they could just keep going with something that necessarily isn't going to work for them? Like, where is the disconnect? Do we need more educational from the clinician side? Is it more on the patient side? Is it a meet in between? Where is the disconnect for the awareness of what they could be doing that is not working right now, or could not work for a long time, that they don't realize could not work for a long time?
Yeah, it's a great question. And I think like with any big problem, the disconnect is at multiple levels. It's not, we cannot just finger point and say, oh, it's the fault of the referring physicians, or it's the who are not referring, or it's the fault of the patients for not asking, or it's our fault, for not eh, listening better, to what patients need. It's I think it's a combination of all of the above. And I will start with us, the epilepsy specialists, the surgical epileptologists. We have to do a better job of listening to patients and listening to community neurologists to better understand what is it that is truly keeping them away from this procedure, rather than us assuming that, they don't know and we have to go educate. There are real practical obstacles towards getting a surgical evaluation and referring for a surgical evaluation. Things like availability of surgical programs, insurance coverage of different procedures that are needed for surgery, better communication on the process of the surgical evaluation. So there is a lot that is objectively making it more complicated for physicians to refer and for patients to get the workup they need.
Mm-hmm.
That is on us. There is also a piece that is on the patients, which is being more aware of resources and information that they can be empowered with to go and seek the care that they need. There is this hump that is difficult to overcome with, oh my gosh, I'm going to get brain surgery, where it's based on a trusting relationship between the patient and the physician, that the patient should ask questions about everything that they're worried about. And then on the referring physicians and the community neurologists end, it is an issue of being engaged in the long-term care of their patients, but at the same time being aware and willing to seek a definitive treatment beyond, I will refill the prescription and just continue to follow this patient up.